Next presentation is going to be the feasibility of virtual examinations for vascular surgery trainees. This will be presented by future Dr. Mark Zemela from St. Louis University.
Hi, thank you for the honor of speaking today. My name is Mark Zemela and I'm a third-year medical student at St. Louis University. I will be discussing the utilization of virtual mock oral examinations for senior vascular surgery trainees. The authors have no competing interests to declare and no specific grant or funding was received. As a result of the COVID-19 pandemic, the last year has seen a rapid shift towards remote learning and virtual platforms, such as this VESS winter meeting, utilizing new technologies to replicate or substitute the traditional paradigms of in-person education, meetings, and conferences. The advantages of this technology-enhanced learning include eliminating costs with lodging and transportation, the ability to attend from any place with internet connectivity, and the capability of educational recording and sharing after the fact, which may increase overall convenience and availability for a wider audience. However, disruptions in clinical work, duty hours regulations for trainees, eye and body exhaustion from screen fatigue, lack of hands-on skills training, and audio-video streaming issues plague technology-enhanced learning. Mock oral exams are valuable tools to assess knowledge and prepare for the surgical certifying examinations. In a recent study by one of our authors, it was demonstrated that while most program directors in vascular surgery feel these are important, only around half utilize them in their training paradigms. Preparing for board examinations with these mock oral exams has traditionally and solely been done in person, despite a 2016 systematic review of e-learning for surgical training finding technology-enhanced learning to be at least as effective as other methods of training. Because the pandemic resulted in the canceling of in-person testing across the country, we sought to understand the feasibility of conducting virtual oral examinations as well as opinions of vascular surgery program directors regarding the use of virtual platforms to conduct both mock and real virtual certifying exams. 44 senior vascular trainees from 17 institutions took part in a virtual mock oral exam conducted by 38 practicing vascular surgeons via Zoom. Each examination lasted 30 minutes with 4 clinical scenarios. An anonymous survey pertaining to the conduct of the examination and opinions on feasibility of using virtual exams for the vascular surgery certifying examination were sent to all examiners and examinees. A similar survey was sent to all vascular surgery program directors as well. The overall pass rate was 82% with no correlation with training paradigm. Of those surveyed, 73% of trainees, 76% of examiners, and 48% of program directors responded, with demographics of these respondents shown in the table on the left. The table on the right breaks down how examinees, examiners, and program directors responded to questions regarding the feasibility of virtual exams moving forward and general opinions of the mock orals. All 3 groups overwhelmingly believed that virtual mock oral exams were or would be beneficial for trainees. While the majority of trainees and examiners believed they were able to communicate and express their knowledge and confidence as easily virtually as in person, program directors were less likely to agree confidence could be assessed virtually. The majority of respondents thought the certifying examination of the Vascular Surgery Board could be offered virtually, although no groups thought virtual exams were superior to in-person examinations. While cost-benefit was perceived in virtual examinations, security of examination was a concern. When comparing integrated vascular surgery resident and vascular surgery fellow examinees, no statistically significant differences were noted between their responses. Both groups favorably viewed the virtual assessment and their ability to perform well. Both groups are open to the idea of a virtual certifying exam, although neither group believes virtual exams are superior to in-person evaluations. Of note, 29 of 32, or 91% of all trainees, believed they were more prepared for the certifying exam after the virtual mock oral exam. In conclusion, performing virtual mock oral examinations for vascular trainees is feasible. Both vascular surgery trainees as well as program directors feel that virtual certifying examinations should be considered by the Vascular Surgery Board. Thank you, and I'd be happy to take any questions.
Thank you so much. Excellent presentation and very relevant given our current circumstances. You are to be congratulated on good work. So as we're waiting for some questions to pop up, let me just move my chat window into view here. I'm going to start with a couple. I think one of the big ones, and you mentioned a little bit about this, is security. So I know from the general surgery board exam, oral board exam, that all those scenarios are in little pockets, little secret caches all over the place. The vascular one probably still, because it's newer, a little bit harder to find the scenarios. So what about people recording these? Set up a camera behind you. You're recording the screen, the images. That kind of defeats some of the purpose of the exam then.
Yeah, thanks for the question, Dr. Lowe. And thank you, VESS, for allowing me to speak today. It's a great honor. Happy to be here. On the surveys we sent out, we mentioned cheating in a very vague way. We didn't, dive in anymore to explain different ways of cheating. So when we asked how examiners, examinees, and program directors felt about the ability to cheat on a virtual exam, students felt like it wasn't that big of a deal compared to examiners and program directors. They tended to agree that cheating could be an issue, but they ranked some other attributes of virtual online exams as more important or more worrisome. But in terms of cheating, it didn't seem like that was an alarming risk.
Okay, and I know it's already ongoing, the certifying exam. So Bernadette Aviola just mentioned that the vascular certifying exam went last week, and it went great virtually. So I know it's there, but I think some lingering questions regarding that overall. And so I'm doing virtual interviews for the residency now, and obviously I missed the live interview. I think one of the things I've discussed with a lot of people is you miss out on a lot of the small visual cues that you get when the person's sitting in front of you, which can translate to certain elements within an exam type scenario where you may alter your line of questioning, your tone, or even provide a helping hand if there's some real struggle, which I'm not clear that it necessarily comes across when it's in a virtual setting. What are your thoughts on that?
Yeah, great question. So we didn't ask specifically about that, but we did inquire about, how people felt that they could convey their confidence via, camera. And all examinees, examiners, and program directors felt that confidence could be both assessed and conveyed well over a camera, over a virtual connection. It was more so the examinees and examiners believed confidence can be shared just as well live as over a camera, whereas program directors tended to see confidence as not being able to be expressed as well. There actually was a significant difference between examinees, examiners, and program directors in how they perceived confidence being conveyed over a camera.
Okay. Yeah, I mean, definitely, I think it's a different skill set that we all have to master. Last question from me, unless there are no others from the audience. Your thoughts then, if, I think the virtual is probably here to stay, but even if it is not, and we go back to in-person, it seems based on your talk that the virtual mock oral exam is going to be the way to kind of prep these students for it, doing away with maybe some of these prep courses now.
Yeah, there's definitely a lot of interest in continuing, virtual options, looking for, past this pandemic, for, not just certifying examinations or board exams, but interviews and other aspects that we've kind of gotten used to over this past year. So it'll be it's interesting to see how certain organizations and how certain exams and interviews are conducted in the future, whether both will be offered or virtual exams will be the only option remains to be seen. But like you mentioned, the real boards were done virtually recently. And although they were a little bit longer than they may have been in person, there were no major issues with it. So it was, a proof of concept that it works. It can work.
Great. I'm sure still just as stressful. Excellent job. Great presentation. And we'll just move on to the next one.